Margot Sukenik. I'm doing my head-to-toe assessment for Maryville University's Nursing Health Assessment 612. This is my patient, Christina. I have instructed her to empty her bladder. We've done a full set of vital signs, including height and weight. We have tested her near vision with the Rosenbaum card and her distant vision with the Snellen chart. She's in a gown, and we are ready to begin. So first, head to toe, I'm going to start with her head. I'm going to inspect her head, then I'm going to begin to palpate for any masses, make sure she's normal cephalic, the positioning of the ears and everything while I'm palpating. And then I'm just going to go ahead and start with the eyes. So first I'm just going to inspect the eyes. I'm going to look at her eyelashes, make sure that they're growing outward away from her face and kind of tilted up. I want to palpate the lacrimal apparatus. That's great. And I want to make sure there's no extra exudate or extra tears. And then I'm going to go ahead and just test her pupil reflex. Make sure they're round, equal reactive to light and accommodation. And so first we do the direct, and then I'm looking for consensual. I'll do the same thing on the other side. While I've got this out, I can go ahead and do the cardinal fields of gaze, checking for extraocular movement. So just go ahead and follow my light without moving your head, just with your eyes. That's great. While I have this out, I'm going to move on to the nose. And I'm just going to look inside the nose, make sure that the turbinates are the same color as the inside. Make sure her septum is not deviated. Normal hair pattern. And the position of the nose. I'm going to palpate her sinuses. Is there any tenderness or pain here? So the frontal, maxillary. Here. Now I'm going to move on to her ears. Just going to look at her ears first. I'm going to palpate the auricle, make sure there's no masses. I'm looking at the position. I'm going to go ahead and look inside her ear as well with my otoscope. I'm checking for any excess cerumen and that her tympanic membrane is a pearly gray. While we're doing the ears, I'm going to test her hearing with two tests. First, the Weber test. So I'm going to strike the tuning fork, place it here. Do you hear this equally in both ears? Mm-hmm. Great. So that's the Weber test. I'm going to do the Rene test, placing this on the mastoid bone. Tell me when you don't hear it anymore. No. And tell me when you don't hear it anymore. I'm watching the clock because we want to make sure that the air conduction is twice as long as the bone conduction. I would repeat that on the other side. Now I'm going to do the whisper test. Just cover one of your ears and repeat what I'm saying. Baseball.
Baseball.
Now the other ear.
Grapefruit.
Great. While we're still on the face, I'm going to check cranial nerve function. Open your mouth for me, please. And I'm going to look for her reflex. Great. And her gag reflex. Great. While I'm looking in the mouth, though, open back up for me. Thank you. I'm going to get my light out and look in here. I'm going to go under the tongue, looking because it's a common spot for oral cancer. Make sure there's no lesions. You put your tongue down for me. Thank you. Looking at her teeth for number, hygiene, making sure that she's well hydrated. And then I'm going to test for sensation. Do you feel this?
Yes.
Great. This. And this. Great. Now I'm going to move on to her throat. Well, before the throat, let's do your neck range of motion. Can you touch your chin to your chest for me? And then now backward. Great. And side to side. There.
Okay.
And then, yeah, that too. That's fine. Thank you. Okay, and then if you can push against me. And this way. And this way. And this way. Great. So now we're going to check for trachea position and thyroid. First inspecting, then palpating. And then I'm going to listen to, while I'm at the neck, I'll listen to the carotids with the bell of my stethoscope, one at a time. Also palpating. can you swallow for me? I just want to make sure that the thyroid is moving smoothly. Okay. So we've moved on, we've done the neck, we're going to move on to the chest. Well, before that, I'm going to do the lymph nodes. So I want to feel all your lymph nodes. I'm going to start with the pre and post auricular, the occipital, the tonsillar, the submental, the submandibular, the superficial cervical, the deep cervical, posterior cervical, the deep, I said deep cervical. Okay, and then the supraclavicular, which we don't want to feel. Great. Okay. So now we can move on to your chest. So first, I'm going to start by inspecting, and I'm looking at the way she's breathing, making sure there's no heaving, accessory muscle use, just that her respirations are non-labored and equal. Then I'm going to palpate. I'm just going to palpate the chest wall, making sure I don't feel any masses. Okay, and I'm going to palpate for tactile from the chest here. Can you say 99?
99.
I'm going to do that on the back too. 99.
99.
And again?
99.
Great. Now I'm going to listen to your chest, side to side, comparing, breathe in and out, and in and out, and in and out. Okay, now I'm going to listen to your heart. Listen to the aortic, pulmonic, Erb's point, tricuspid, and mitral. Now I'm going to check for diaphragmatic excursion. So I'm going to have you take a deep breath and hold it. Okay. Percussing down. Okay, let go. Take some normal breaths for me. I would normally mark the spot right here. Now, again, take a deep breath and exhale it all out and hold it there. Great. So percussing back up. So here the difference is about 3 centimeters. You want to see about 3 to 5 centimeters, so that's excellent. Moving on. Well, while I'm back here, I'm going to go ahead and palpate for expansion, watching my thumbs. Take a deep breath for me. As my thumbs expand, I realize she's expanding equally, and that's great. Okay, I'm going to have you lie down. So we're going to move on to the abdomen. So if you want to lie down here, we'll cover you up. Sometimes the patients can be ticklish. So as